I'd like to welcome everyone back to our discussion on hormone replacement therapy and the effect on your life as well as your family and friends' lives. I'm Dr. Danny Shaban with Dominion Women's Health, and I am honored to have one of my patients here with us today. Her name is Shelly, and we're going to talk about how hormone replacement therapy has affected her life and made changes in her life. How are you?
Good, and you?
Good. I just look back to the years that we've been together. I was looking at like some of my records today, and you've been with us for hormone therapy for almost 8 years.
Yes.
Do you remember the first day you came in?
Yes, I do. I came in because I just didn't feel right. Things were not going good, body, mind, spirit, everything. And I was diagnosed with depression prior to coming to you.
It's amazing. I usually tell my friends and family, if I can remember what happened, that's not always a good thing. And I remember the first day Shelly came in the office and you were with your husband that visit. Mm-hmm. And she couldn't even have eye contact with me. I mean, she was looking straight down, introduced myself, and you were referred by a friend in regards to hormone therapy.
Yep.
And I think the biggest shocker for me with hormone therapy was the effect it has on women and their body. Because I think we gave you your first dose like a week or two later. And when I saw you 4 weeks later, it was like someone turned a light switch on.
Yes.
And since then, she's been wide awake. So do you feel like it's not only changed you emotionally, helped with depression, has it helped with anything else for you personally?
I sleep better. Headaches are very few and far between now. Sweats, oh my gosh. I always know when it's time for my pellets. I start sweating, and then, a few days later, the headaches come on, and then the sleepless nights. And I always look at my little calendar and I go, oh, it's time to go see Danny.
That's awesome. I just think that what we've realized, and we've talked on this podcast before in regards to hormone therapy, is everyone thinks that you're supposed to transition for 3 to 5 years with hormone therapy and then just grin and bear it. And Shelly's a great example of why do you have to grin and bear it? Why do you have to live with depression? Why do you have to live with some of the side effects of not having hormones? And this is what we've found all around the United States from physicians and providers that are providing hormone therapy is that it's a game changer. I mean, would you ever want to go back or come off of hormones at all?
I think you and I, had a very small conversation about, how long would I be on it? And, at this point, I can't really foresee myself coming off of hormone therapy because, being misdiagnosed with depression, in the very beginning, I've learned to advocate for myself because of that and because of you. Okay. I feel better. Even when things come about that would normally drive someone into anxiety or severe depression, I have learned to push through it, and it's because my hormones are where they need to be. So if it wasn't for that, I don't think I could have made it through some of the trials in life, since starting pellets.
Well, I'm happy that it's worked out for you. The one thing that I try to express to a lot of our patients is that it's not the Holy Grail. So if I have a patient that comes in who has anxiety and depression, yes, it can definitely be just like Shelly, the cause of the anxiety and depression. But there also is patients out there that have mental illness. There is patients that have bipolar, schizophrenia, all different types of medical disorders in the psychiatric field that are not hormonally related. So we're not trying to claim that this is the Holy Grail, it's going to solve everything. But this is something that we should always look at with our patients, whether they're complaining of fatigue, loss of memory, anxiety, depression, decreased sex drive. Let's figure out what's going on before we just throw a Band-Aid on it and say, well, you should take this antidepressant, or, you know what, let's just throw some testosterone or go to marriage counseling. That's another one that we tend to hear in our practice, is they were referred for marriage counseling. Mm-hmm. So I think it's a game changer. And Shelley will even tell you that it's most patients that do the bioidentical route, whether it's creams or pellets, they're usually referred by a friend who's already doing it. And always what I hear from patients is when they go to an appointment or they're going to an event, their friends and family go, okay, what have you been doing that's different? You look happier. You look like you have more energy. You look more in shape. Mm-hmm. And I don't know if people noticed that with you once you got your hormones.
It was definitely the skin completely changed. My hair, even my hair felt healthier. I definitely had more energy. Sex drive, most definitely. It definitely increased. It's just, I think when you feel better, you look better and you have a better frame of mind.
That's awesome. Did you notice that, and it didn't have to be like the first month, but did you notice now that you've been doing the hormone therapy for a few years, have you noticed that your decision making, your business acumen, like what you want to do in life is more clear versus cloudy, or what have you noticed different?
I think I'm more calm. I can process better. I can focus better. I don't know. It's just a clearer mind, I guess, is the only way I can explain it.
That's awesome. Mm-hmm. I'm just excited that it worked for you, and that you finally at a point in life where I love what I see. I mean, the person that I saw the first day and the person that I see now are two different people. And I know your family sees that person mm-hmm. that was the person you were before you went into the menopausal symptoms. Mm-hmm. So I think the big thing is what we would all like to know is your story on hormone therapy, what got you into hormone therapy, and your story.
Originally, I had gone to my primary care physician and basically just said, something's not right, and I feel sad. They immediately put me on depression medication. Then I ended up starting a birth control method of the depot. Been on it for years, and then come to find out that after doing my own research, that the depot and the depression medication that I was on were kind of counteracting each other. I had also decided to get off of the depot, and a few years later had the Eshore implantation. After talking with a friend of mine about all the problems I had started having, I was having pains in my right hand side. So she referred me to come see you. When I came to see you, I couldn't look you in the face, couldn't look you in the eyes. I was just in a tremendous amount of fog. Come to find out that the Eshore had actually punctured through my ovaries. You did the surgery for that, and then we began talking about hormone replacement therapy. And that's when you introduced me to pellet therapy. Shortly after taking pellet therapy, that's when I started noticing my life was changing. I was more focused. I had a sex drive again. I was happier. It was just an all-around better experience for my life. My hair is healthier. My skin is healthier. I'm smiling. I definitely have more energy.
What does your family say?
They just love the new me. They are happy that we have finally figured out something that would help me be a better person and to live a healthier life.
That's awesome. That's awesome. I always love to hear stories like that. How did you feel about the pellets and the procedure, and now that you've done it more than once?
So for me, the initial scare was whenever I would get the numbing medicine. Mm-hmm. And I've been coming to you long enough now that you have to wait a few minutes for the numbing medication to take effect.
What she's trying to say is she slows me down. She makes me slow down so that I don't go like 100 miles an hour.
And so once you numb it, I don't feel a thing. Usually about towards the end of the day, that's when I start, the medicine is worn off and I can start feeling some of where the insertion was made. You have to wear a big old white bandage on your butt for a few days. After that, you can remove the bandage, and then you've got the steri strip that falls off on its own. And then after that, you're good to go.
That's good. That's the one thing that I don't, and maybe it's because I don't ask for that feedback, but like, what does it feel like 2 hours later, 3 hours later, the soreness? Mm-hmm. I mean, I've had patients tell me later on, they go, I felt it that evening, mm-hmm. but then it just wears off and you don't feel it anymore.
I mean, sometimes I'll have a lump where the insertion was. It's not painful or anything. It's just a lump, but it does go away.
Good deal. Well, the big thing for us is we try to schedule the patients for 4 weeks to check your labs, make sure we've hit our target. The other thing is to bring you back within 4 months. Yes, we have some patients that go 6 months. Some people go 8 months. What do you use as your target?
Typically, I get the night sweats. That's what starts it. Then a few days later, that's when my headaches come on. And then I start losing sleep. As soon as I start losing the sleep part of it, usually after the first night of not getting any sleep, I'm like, it's time to call Danny.
Yeah. And that's the big thing that we try to educate our patients. We want to get into a set routine with the hormone therapy and the pellet therapy. You don't want to get to a point where you're having the hot flashes, the night sweats, the mood swing. All hell has broken loose, because then you're trying to raise the level back up. So I like how you say, as soon as I start feeling these symptoms, I get the pellets. Initially, for the first year or two, we schedule patients for every 4 months to come in and get their pellets. But is it true that we have patients that go 6 months, 7 months? Absolutely. It just on how your body absorbs them. And as long as there's no big changes. And when I mean big changes, if I have someone who weighs 200 pounds and now they weigh 150, yes, the absorption rate's going to be different. Or if they weighed 150 and they've gained a lot of weight, the absorption changes. So we tend to measure the levels.
And you typically tell me all the time I don't have enough fat.
Yeah, you're way too skinny. I'm trying to think of what else I can ask her. She's pretty much answered everything for us. Anything you want to ask?
Just as a person, advocate for yourself. Don't always, immediately go with, popping a pill. Talk to your doctor, talk to your primary care. If you don't have a gynecologist, I can definitely refer somebody to you that is astounding and wonderful. And I will say from the very get-go, when I came to see Dr. Shaban, he told me that I treat all my patients like they are my sister, and he has treated me like his sister every single time.
Well, that's awesome. Well, thank you for joining us today. And at any point, anyone has questions, you can reach out to us by calling our phone number, our website, or just follow our podcast. We're still trying to figure out a name for the podcast. So if you can think of any names, please feel free to reach out to us. We've had some crazy names and we've had some straightforward names. So get back to us and look forward to our next podcast. Thank you.